In this episode of the Rich Roll podcast, Rich Roll engages in a discussion with Dr. Ted Schaeffer, a leading authority in urology and prostate cancer treatment. Dr. Schaeffer, who serves as the chair of urology at Northwestern University's Feinberg School of Medicine, shares invaluable insights into prostate health, the importance of early screening, and the evolving landscape of prostate cancer treatment. This summary encapsulates the key points discussed in the episode, providing essential information for men regarding prostate cancer prevention and management. Dr. Schaeffer begins by explaining the role of the prostate, a small gland located below the bladder in men, which produces seminal fluid that nourishes and transports sperm. As men age, the prostate naturally enlarges, leading to common urinary symptoms such as a weak stream or incomplete bladder emptying. While prostate cancer is prevalent, it is crucial to understand that many urinary issues are not cancerous, but rather a result of benign prostate enlargement. The conversation highlights the alarming statistics surrounding prostate cancer, noting that approximately 250,000 men are diagnosed each year, with around 35,000 deaths annually. Despite these numbers, prostate cancer is often manageable, especially when detected early. Dr. Schaeffer emphasizes that cancers do not adhere to rules. Thus, proactive screening is essential for early detection and treatment. Rich Roll candidly admits to never having been screened for prostate cancer, prompting Dr. Schaeffer to stress the importance of regular checkups. He notes that men typically engage with healthcare providers later in life, often only when problems arise. This reactive approach can be detrimental, as early detection significantly improves treatment outcomes. Dr. Schaeffer advocates for men to begin screening at age 50 or earlier if there is a family history of prostate cancer. The primary method of screening is the PSA, prostate-specific antigen blood test, which measures the level of PSA in the bloodstream. Elevated PSA levels can indicate the presence of prostate cancer, but they can also result from benign conditions. Therefore, tracking PSA levels over time is crucial for understanding individual risk. The discussion transitions to the unique relationship men have with urologists. Dr. Schaeffer explains that urologists play a vital role in not only diagnosing prostate cancer, but also in managing overall male health. He encourages men to be open about their health concerns, including urinary and sexual function, as these discussions can lead to better outcomes. Dr. Schaeffer also addresses the stigma surrounding prostate health, noting that men often feel embarrassed to discuss these issues. He emphasizes that talking about prostate health is a sign of strength, not weakness, and encourages men to take charge of their health by seeking help and information. The conversation delves into the advancements in prostate cancer treatment, particularly the evolution of surgical techniques. Dr. Schaeffer is a pioneer in robotic prostatectomy, a minimally invasive surgical procedure that has revolutionized the treatment of prostate cancer. He explains that the Da Vinci surgical system allows for greater precision and reduced recovery times compared to traditional open surgery. Dr. Schaeffer recounts his training under Dr. Pat Walsh, a legendary figure in urology who developed techniques that improved surgical outcomes for prostate cancer patients. The combination of early detection through PSA testing and advanced surgical techniques has significantly reduced the number of men diagnosed with metastatic prostate cancer at the time of diagnosis. Rich Roll and Dr. Schaeffer discuss the nuances of PSA testing, including the importance of understanding free versus bound PSA. Free PSA levels can provide additional context regarding the likelihood of cancer. Dr. Schaeffer explains that a low percentage of free PSA in the presence of elevated total PSA can indicate a higher risk of prostate cancer. The conversation also touches on the role of MRI in prostate cancer diagnosis. Dr. Schaeffer advocates for MRI-guided biopsies, which allow for targeted sampling of suspicious areas in the prostate. This approach minimizes unnecessary biopsies and helps identify aggressive cancers that require treatment. Dr. Schaeffer emphasizes that lifestyle choices can impact prostate health. He notes that diet plays a significant role, with studies showing that men from certain cultures, such as traditional East Asian populations, have lower rates of prostate cancer due to their plant-based diets. He encourages men to adopt healthier eating habits early in life to reduce their risk of developing prostate cancer. The discussion also highlights the importance of regular exercise and maintaining a healthy weight. Dr. Schaeffer explains that obesity is a risk factor for various health issues, including prostate cancer. He encourages men to engage in physical activity and make conscious dietary choices to support their overall health. As the conversation progresses, Rich Roll raises the topic of erectile dysfunction, a common issue that many men face. Dr. Schaeffer explains that erectile dysfunction can be a sign of underlying health problems such as cardiovascular disease or diabetes. He stresses the importance of discussing erectile dysfunction with a healthcare provider, as it can be an indicator of more significant health concerns. Dr. Schaeffer reassures listeners that erectile dysfunction is a common issue and that effective treatments are available. He encourages men to seek help and not to feel embarrassed about discussing their sexual health. The conversation underscores the importance of open communication with healthcare providers regarding all aspects of male health. Looking ahead, Dr. Schaeffer discusses the potential for advancements in prostate cancer treatment, particularly in the realm of genomics and personalized medicine. He explains that understanding the genetic makeup of prostate cancer can lead to more targeted therapies, improving outcomes for patients. The conversation also touches on the role of immunotherapy in cancer treatment. While prostate cancer has not yet seen the same breakthroughs in immunotherapy as other cancers, Dr. Schaeffer remains optimistic about future developments in this area. In summary, the podcast episode featuring Dr. Ted Schaeffer provides a wealth of information for men regarding prostate health and cancer prevention. The discussion emphasizes the importance of early screening, open communication with healthcare providers, and proactive lifestyle choices. Dr. Schaeffer's insights into the advancements in treatment and the evolving understanding of prostate cancer underscore the need for men to take charge of their health. By fostering a culture of openness and awareness, men can better navigate the complexities of prostate health and reduce their risk of cancer.